Okay, so we've talked a lot about hip drops and anterior pelvic tilts and the OP mechanics that cause you to develop OP. And knowing how people and patients generally react, the first thing you're going to do is jump on the internet and go, how to fix a hip drop, how to fix an anterior pelvic tilt. And you'll probably come up with a lot of information with some exercises like glute bridges and clams and TheraBand work to try and fix individual muscles that are causing your hip drop or anterior pelvic tilt. Let me implore you right now to just stop what you're doing. Those exercises might help improve those particular issues like a hip drop and an anterior pelvic tilt. But the problem with osteitis pubis is that all those mechanics, all those OP mechanics, your hip drop, your lock sacroiliac joint, your knocked knees, your anterior pelvic tilt, your hip drop, they are all intertwined and interconnected. You don't have an OP patient who only has a hip drop and doesn't have a lock sacroiliac joint. You have them, they may have different degrees of these issues, but they'll have all of them because OP is the interconnection of all these mechanical problems. And to fix those issues, you can't just take one out and strengthen it. One issue causes the other issue, and it's just one big mess that needs to be fixed all at once. So let me give you an example of how this works. So let's take overpronation as an issue. So you're running along and your foot keeps rolling in too much and it just keeps overpronating. Now as that occurs, you're more than likely going to get too much internal rotation from the tibia as well at the knee joint. So now your knee is twisting in too much. Now as your knee twists in and rotates in, it's probably going to bow your knee a bit, knock your knee a bit and cause some knocked knees. And it's going to also cause the femur to internally rotate like that. Now, this is an issue for your glutes because as the femur internally rotates, it makes it very hard for your glute muscles, which live in here, this area through here, to fire correctly if your femur is internally rotating. And so all of a sudden, with your glutes not firing, you start to see a hip drop because of it. And so you can see that that chain gets extremely complicated. Overpronation leads to the internal rotation of the tibia, which leads to the knees knocking. You then get the internal rotation of the femur, which then makes it hard for your glutes to activate, which then leads to a hip drop. Now, if you jump on the internet, they're probably going to tell you, hey, you need to strengthen your glute med so that when your hip drops, the glute med can pull it back into place. And it's a muscle that attaches like this, so it can yank it back into place. And that's well and good, and you might see some slight improvement for your hip drop, but that's not going to be enough to fix your OP because your glute med is going to really struggle to switch on because your foot is really preventing it from getting the best contraction possible because of those series of events that leads to that internal rotation from the femur. The only way to fix OP permanently is to engage in whole body rehab, where you address and get your entire body to work together as one functional unit. Now, in further videos, we'll jump into explanations of the 6 functional systems that generally fail in OP and the type of exercises that you need to do to stabilize and get your body to work functionally again. But for now, just understand that if you're engaging in isolation exercises, they may have some help initially, but they are not going to provide you with a long-term solution. So please stop, keep reading, and put your energy into finding the right answers for fixing your OP.